Hello everyone, I am Dr. Archisman, consultant, orthopedic and joint replacement surgeon currently practicing at Star Hospital. Our aim is to provide international standard joint replacement surgery at Siliguri. For this, we not only want people of Siliguri but also people from the adjacent states, from the adjacent districts and also from other countries to come here and avail the type of facilities that we are providing. We are ready to provide predictable, safest and the best result in joint replacement surgery with affordable cost. Today in this video I will be discussing about the most commonly asked questions about joint replacement surgery. So regarding joint replacement surgery, the most common questions that come in the mind of anyone that what is total knee replacement. For this we need to understand the knee joint. This is our knee joint, which is one of the largest joint of our body, and this blue part what we can see is the cartilage. With time, with aging, this cartilage erodes and the bone gets exposed, and in young patients suffering from some kind of diseases like rheumatoid arthritis, juvenile rheumatoid arthritis, even due to some trauma, this cartilage may get eroded. When the bone is exposed, this may cause pain, deformity and swelling, which may affect the day-to-day activity of the patients and may also affect his professional life and may just affect on his sleep pattern. And this kind of patients, when the deformity has already occurred, the medical treatment is beyond. The medical treatment cannot provide the treatment when the deformity has already occurred. For this we require the surgery which is called the total knee replacement. In total knee replacement, what we do, we just excise the diseased part of the joint and we cover. It is just a resurfacing surgery. We just cover the joints with metal and poly. So in the bone is covered and there is no friction between the bones. There is a friction between the metal and the poly, which reduces the pain and also improves the deformity of the patients. The next question which comes in mind of the patient, that what is the time for the surgery, or what will be the appropriate time when the surgery needs to be done. So in this case what I want to say, that no one should delay the surgery, because once the deformity has occurred and if the deformity is in higher grade, the outcome of the surgery is directly proportional to that. If there is decreased range of motion, then also after the surgery, this after the joint replacement surgery, people may not have that much good result. So we should never delay in the surgery and it should be done in the appropriate time. Many of the patient asks like that, my patient is such an elderly patient, should this surgery be done? In that case what I say, that this is the disease of the elderly people. This degeneration of the joint takes place in elderly patients only. So this is surgery is very safe for the patients, even for the elderly patients, even with patients with diabetes, renal disorder. We just optimize the patient before the surgery, and once the optimization is done, this surgery can be done easily. Some people even ask about partial knee replacement. What is partial knee replacement? In partial knee replacement, when the deformity is correctable, we can do this partial knee replacement. Like this is a total knee replacement which has been done, where the whole surface of the joint has been replaced. In partial knee replacement, what we do, that only the affected part of the joint is replaced. That is called partial knee replacement. Yes, this kind of facility is also available at our center and we can do this kind of surgeries easily. Many people ask that which implant will be the best one, either the foreign implant or the Indian implant, or the costlier implant. But what I say, that there is no such specific brand which is the best one. It mainly the longevity, the survivorship, the range of motion of the patient in post-operative. It doesn't depend on the brand of the implant, because all the implants that we are using has long follow-ups and all of them are doing good in the patients that we have already operated. Now this mainly what depends on is the surgical technique, the surgical skill of the surgeon and also the attitude of the patient. Because if the patient is not doing exercises properly after the surgery, their range of motion will not be good. So the role of implant is very less, and the main thing is the precision that the cuts has been done, how precisely the cuts have been done in this patient, and the type of surgery that has been performed by the surgeon. Again, many people ask about the robotic knee surgery. So it's nothing like that, that the robot do surgeries. It is done by the surgeon. Only the cuts that we take in the joint is decided by the robots, and obviously those cuts are more precise, and this robotic surgery gives a better result than that of these manual knee surgeries. Again, many of the patients have queries that whether to do one knee at a time or both the knees at the same time. So, if one of your knee has some high grade deformities, one knee can be done, and again later the other knee can be prepared. Both of them are good eitherwise. And if both of your knees have deformity, then it's better to get it done in within 7 to 14 days of the first knee. Many of the surgeons practice doing both knees at the same time, but I prefer to do one knee at a time with an interval of 2 weeks for the other knee. And the last thing that many patients thinks about the post-op protocol. Now, when will my patient walk after the surgeries? Generally, what we do, we keep the patient on the day of surgery. For one day, we keep the patient in ICU for proper monitoring in the post-op period. After the next day, very next day, after the change of dressing, we allow our patients to walk, whether one knee has been done or both the knees have been done. Just to summarize what I can say, knee replacement is a very rewarding surgery, and the result depends on both the surgical skill of the surgeon and the patient's attitude. It is a very successful and life changing surgery.